Alarming new numbers from the CDC about heroin use in America. It is stretching into new communities, with addiction issues sharply rising among women and the middle class. Heroin-related deaths have increased fourfold from 2002 to 2013. Our Dr. Jon LaPook is here with more now. John, good to see you again.
Jeff.
What is behind this rise in heroin use?
You know, nobody's really sure exactly what's going on, except for it seems to start with an addiction to these oral pills, things like Percocet, oxycodone, things like that. And I can tell you from my own practice, what's happening is there's been a crackdown on the use of these oral narcotics. So right now, if somebody comes in and they want me to prescribe Percocet or oxycodone, something like the controlled substance, I've got to go online to a New York State database. I've got to put in the person's name, their date of birth, and find out, have they gone to other doctors? Are they doctor hopping to try to get different prescriptions?
So because it's more complicated to get those sort of narcotics, then people are moving to cheaper heroin.
Right. If you're addicted, then you say, okay, I'm having trouble getting it from my doctor the way I used to, say, by, going from doctor to doctor, and now I'm going to go to the street. And the street now, as you know, heroin is quite cheap. It can be anywhere from $10 a bag to $4 a bag. That's very cheap.
I don't know personally.
No, I know, but we were talking about it earlier.
We have talked about this, and it does sound incredibly cheap for a drug that potent and that dangerous to be that cheap. And apparently regularly available.
Yes, and I think, the CDC is saying, look, first of all, we have to be aware that there's a huge problem here. That's number one. And number two, we have to start doing steps to end this epidemic. That means educating the doctors, educating the patients, having the doctors be able to take a history from their patient that includes the use of drug use. I was just out in the Aspen Ideas Festival, and there was a symposium on this, and one of the big things was doctors aren't asking patients about their history of drug use, including prescription drug use. There's also tremendous stigma, so patients who are addicted have trouble asking for help. And then also doctors aren't very good in general. I hate to say it. I mean, I'm an internist. We're not great at treating pain. So when people come in with chronic pain, we may say, you know what, here, take a narcotic. Really, there are a lot of other things, including anti-inflammatories, even things like biofeedback and acupuncture, alternative medications.
So doctors are prescribing too much, but we're also buying too much over-the-counter medication.
Well, yeah, I mean, you can't get over-the-counter narcotics. So I think it starts at the very, very beginning when somebody comes in and they come into the doctor and they say, I've got pain.
But even basic anti-inflammatories.
Anti-inflammatories, are not, well, they could be bad for you. If you take too much ibuprofen, you can get an ulcer, and if you take too much acetaminophen, you can hurt your liver, you can have other problems, but they're not going to cause an addiction in the way that narcotics cause, going to the head, causing this addiction, and you need more and more, and then finally, you get desperate, and we see what happens.
I find it interesting you say you're not good at treating, doctors in general not good at treating pain.
Yeah. That's true. We're not taught it very well. Maybe it's doing better now in medical schools. There are pain specialists. And by the way, for people who are addicted, there's great medication now. There's something called Suboxone, which is a medication which can be very successful in taking people off of narcotics and easing them onto something else that's more chronic, and it is not giving them the big high. Now, if you take Suboxone and you are not addicted, you can get a high. And recently, there's been some use of that on the street. So it's complicated, and you need to be a specialist with special training, and we know there's a problem. There are not enough of those doctors trained.
But hearing about some of these seemingly innocent middle-class neighborhoods in middle America that are dealing with big heroin issues, I think a lot of people wonder how we got to that place.
I think, again, it's a slippery slope that started with the pills, difficulty getting them onto heroin, and we know that the police departments and the fire departments are being trained in the use of something called naloxone, which you can give to reverse the narcotic overdose. You can give it nasally, for example. I've given it in the hospital to people who have overdoses intravenously or by injection. It's very effective, and it can save somebody's life, because one of the big ways you die when you overdose is that your breathing is depressed. You don't take enough breaths, and you can go into cardiac arrest secondary to that. You give this medication, it can be miraculous, just wakes people up.
Dr. LaPook, thanks very much.